I'm here in Tanzania on the East African coast, where scientists are breeding thousands of mosquitoes in high-security labs. Sounds crazy, right? Why breed more of the very insect that spreads one of the world's deadliest diseases, malaria? But these mosquitoes aren't being raised to infect. They're part of a bold new plan to help wipe out the disease. Malaria still kills a child nearly every minute in Africa, but since COVID, cases being brought into the UK have been on the rise. And with increasing temperatures, experts warn malaria could soon take hold in Europe. I'm here to speak to the families this disease has torn apart and see the sci-fi tech British scientists are working on with African researchers to end the disease for good. I meet Priska Kawiyamba at Ifakara Health Institute site in Bagamoyo, a cutting-edge disease research centre nestled among towering palm trees. She's a PhD researcher developing genetically engineered mosquitoes that can help block malaria. Malaria is a famously tricky disease to stop. Scientists don't just have to battle the malaria parasite, they're also up against the mosquito that spreads it. Priska and her team are injecting mosquito eggs with a gene to slow down the parasite's growth and speed up the mozzie's lifespan, so it dies before malaria can spread. They raise thousands of mosquitoes each month, checking to make sure each has got the right gene. If all goes to plan, they hope to start releasing these modified mosquitoes into the world within 8 years. And with malaria vaccines not quite effective enough yet, this kind of breakthrough is more important than ever. And if it works, it could be groundbreaking, because unlike current malaria prevention tools, it wouldn't require or rely on human behavior to be effective.
Unlike other malaria interventions that are currently in play, like bed nets, anti-malaria drugs, the technology of gene drive relies on the mosquitoes themselves to do the job. So we're ensuring that we break the barriers to healthcare access, ensuring that all communities are met, regardless of their socioeconomic status and geographical location.
To do all this research, you need mosquitoes, millions of them. And breeding that many means feeding them lots of blood, which is not only expensive, but also ethically tricky. To fix that, experts have started raising vegan mosquitoes. Inside this insectary, researchers are breeding mosquitoes without any blood. No cows, no lab animals, just high-protein, nutrient-packed smoothies that trick their bodies into believing they're drinking real blood. It's cheaper, kinder, and way more future-proof. Scientists say this breakthrough could speed up research on other mosquito-borne diseases too, like dengue and Zika.
I mean, that's the definite ultimate goal. The work, we are very positive that what we're doing here is we'll be able to inform, control, and eventually eliminate the scourge that we've had called malaria.
Countless families in Tanzania and across the world have had their lives devastated by malaria. The disease is horrific and often deadly if not treated really quickly. I'm about to visit some families who've experienced the horrors of this disease firsthand.
Alikuwa anaitwa Eric Daniel Richard. Alikuwa ameshatimiza miaka 24. Siku hiyo mwenyewe niliamka asubuhi, kwa sababu nikiwa mkoani nilikuwa napenda sana nikiamka asubuhi lazima niwapigie niongee nao. Kaamka asubuhi nikampigia. Vipi huko mnaendeleaje, si hatujambo? Lakini najisikia malaria. Umeenda hospitali? Akaniambia nimeenda dispensary. Nimepima nina malaria na UTI. Basi nikamwambia dawa umekunywa? Akasema dawa nimepewa, lakini bado najisikia mwili kuchoka, afu kila ninachokula natapika. Katika kuwasiliana ikabidi nipige simu yake ikawa inaita, ikabidi haikupokelewa. Akapiga shangazi yake akasema tunampeleka hospitali, ndio akawa amempeleka Temeke. Ningekuepo ningeanza hata kumsaidia, kwa sababu wakati anamwambia babake aende hospitali alimkatalia kumpa hela. Lakini ningekuepo labda mwenyewe ningeweza kujikusuru kumsaidia, hata nikaokoa hata maisha yake.
After decades of progress, cutting global malaria deaths from 1.8 million in the 1990s to under 600,000 about 10 years ago, cases are now creeping back up again. Rising temperatures and war have driven a surge in infections, with over 620,000 deaths in 2022 alone, mostly in children in Africa under 5. Europe wiped out malaria decades ago, with the World Health Organization declaring the continent malaria-free in 2015, but now the threat is edging closer. Warmer weather means malaria-carrying mosquitoes are moving into southern Europe. Back in the UK, malaria cases brought in by holidaymakers have hit their highest level in over 20 years.
It's a very deadly disease. If I contextualize it within Tanzania settings, where you have nearly 25,000 people dying on an annual basis, most of them being children under 5, you can be able to put this in numbers by realizing there's a lot of kids on an annual basis. But again, those are just people that are recorded. Given that the health system also might be able not to capture the number, we believe that number is actually beyond 25,000 children dying on an annual basis.
While waiting for these high-tech fixes, scientists get hands-on, becoming full-on mosquito hunters. By day, they fly drones over Dar es Salaam, a bustling city on Tanzania's coast. They're scanning for mosquito breeding spots, like pools of stagnant water, leafy patches, the shady corners where the bugs love to hide. With over 70% of the city made up of dense, makeshift shelters like Jemima's, this bird's-eye view cuts through the urban jungle and gives a crucial perspective for the scientists. The drone images are then fed into AI, which creates detailed risk maps. These maps help teams on the ground decide which neighborhoods, even which houses, need extra help. As dusk falls, the mosquitoes start to stir, and the work really begins. Experts go door to door, setting up traps in homes flagged as high risk by the maps.
Using the drones, it helps to cover a wider areas than the routine surveillance where you have to go across the area either by barefoot, taking different information that you need. But using the drones, as you have seen, it helps to understand if you are looking for instance, the breeding habitat, it's easier to map them quickly across the cities, and then you can do the interventions. So it helps to save the lives of people, especially the community who are more affected. And these are the community which live under the poverty, I'll say that, mostly in the unplanned areas.
I was lucky enough to join one of these hunters, Alex Limwagu, a researcher at Ifakara, to the home of Mwana Bibi, a grandmother, mother of 4, and one of the many faces behind malaria stats.
Yani malaria wanangu wanaumwa mara kwa mara kwa sababu ya mbu. Unaona, kutokana hatuna neti. Nenda kama dukani tutachuma dawa ya mbu lakini haitosaidia kutokana na mbu wanazimia tu dakika 2 amenyanyuka. Lakini kwa kuumwa mara kwa mara malaria ni ugonjwa tumefanya kama tumeuzoea, lakini ni malaria yanatuhasiri mno. Yani mwanangu akiumwa na vurugu sio kuniumiza tu, anachanganyikiwa. Najua kwamba mwanangu anapoumwa malaria, yani ni ugonjwa ambao unaonitisha. Najua kwamba dakika 2 tena tunaweza akafariki. Wanawahi sana kukimbilia hospitali apate matibabu kwa haraka. Yani namshukuru sana Alex. Katika 100% nilikuwa ni mpumbavu kutokuelewa, lakini tokaje Alex kwanza kunisababisha jinsi mbu wanavyokuwa na jinsi ninavyoishi na kukinga watoto malaria, namshukuru. Yani toka nipe hiyo elimu imenisaidia.
While we wait for these incredible breakthroughs, the humble bed net treated with insecticide remains our best defense. Long-lasting insecticide-treated nets have prevented over 68% of malaria cases since 2000. Every year, millions of these nets are distributed by global health programs like the Global Fund. But before they reach families, scientists test them thoroughly to make sure they're safe and effective. Today, I'm with Dr. Sarah Moore, a medical entomologist who helps test these products. She's helping me release a swarm of mosquitoes on myself to see if this pesticide still works, even when the net is full of holes.
So are you ready for this? We've got about 100 mosquitoes in here. They are all mosquitoes that could transmit malaria, but I've prepared them specially in our lab, and they do not have disease. There is no way I would ever put anyone at harm's way, but I can't guarantee they won't bite.
Thank you. So I've just released the mosquitoes. I know they're safe, but it still feels a bit surreal and scary that I'm now in a room alone with a bunch of mosquitoes that could bite me. Hopefully the net does its job. For many of these scientists, malaria isn't just a research topic. It's a battle they faced personally or witnessed in their own families or among friends. Their own stories fuel their determination to find a cure.
If you've grown up in a malaria endemic country like Tanzania, you've definitely suffered from malaria. I've suffered from malaria several times as a kid, and it didn't just end there. It also affected my loved ones, my parents, my mom, and stuff. So it's very quite personal and quite motivating that you try not to work to be able to solve something that has personally inflicted you, and it has also inflicted the people that are around you and your loved ones as well.
I got interested in malaria research when I was in secondary school. I went to the Bible College of Wales, which was run as a missionary school. So I had a lot of interactions with people from Africa. And one of my friends at school told me a story of when their friend actually died from malaria when they were living out in East Africa. That stirred my interest because I thought, why is it that kids like me are dying from something that's preventable? I need to do something about this.
One of the experience I have is among my son, my firstborn. When he was 2, he acquired malaria and diagnosed with malaria. By that time, I think it was 2010, 2011. But eventually he got treated because malaria can be treated, can be prevented, as long as you do it on time. If you let it continue, that's why you lead to the severe and the death can happen. But by that time, we managed to treat him, and now he's 13 years old, free from malaria, I'll say, and he's doing the school well. It was scary because the first son, or the firstborn, as a parent, it's worry, but being born in an area where we see a lot of people at hospital diagnosed with malaria, and somehow you give yourself optimistic that it will be okay. It's a matter of like treatment, and then get treatment, and it's out of the danger. Being a Tanzanian born who grew up in the village, I've contracted malaria many times, but also my children have been having a couple of episodes of malaria. Luckily that we have some good health system in the country in terms of addressing the challenge, but you wouldn't want as a human being to contract the disease because the experience you go through is quite traumatizing. And in that regard, from early on when I even joined the Fakala Health Institute, I realized I'm coming to do something which is for a good cause of the public health. And I've been working on entomology for the last 18 years, and I believe I continue working in this space to make sure that one day we might have a tool that will be able to eradicate the disease not only in Tanzania, but across the region as well.